Guys, welcome to your Tiny Tongue Tips tutorial. It's Jay from Simon Says. You guys know me by now, and I'm so excited today to be here with Emily Metzer.
Hi, everybody.
The co-creator of the Tiny Tongue Tips program. I'm so grateful to her for all the effort and time and work and hours that we put into creating the program, and I'm super excited for you guys to learn it and to be able to utilize it in your practice, in your business. The goal is to get early intervention and benefit for our patients, but also hopefully to increase your revenue for your business. What we want to do today is kind of take you through the Tiny Tongue Tips program, tell you how we created it and why we created it, and then take you through the binder itself. So you'll see us at the beginning while we talk about it, and then we're going to go away and take you through the program so you can see each aspect of it. So I think Emily's going to talk about kind of how we came up with this idea. Yeah.
So as you all may know, Jay prefers to work with adults, and I really have kind of honed in my practice on working with preschoolers. So I currently work in a preschool setting full time, and I do this on the side, but it's really my passion. And what I was seeing over and over and over again was children were coming through my caseload, and we would try to work on articulation, we would try different things, but the progress just wasn't there, and we were missing something at this early age. And so really Tiny Tongue Tips came from a modification of Jay's program, Tongue Tips. And so what we've done is we've taken all of the exercises and we really modified it down for the younger child and really added some different aspects that we know are important, such as chewing and feeding, such as breathing, as you all know. We've added aspects of exposure to speech sounds that we know are at risk for children who have orofacial myofunctional disorders. So we hope you really enjoy the program. We've had a lot of fun making it, and we're excited to share it with you.
Yeah, and also I think a valid point is that when so many professionals, when we go out to talk about what we offer as speech therapists and myofunctional specialists, they always ask the same question, and that question is, how early can you start? And I used to have the answer of, well, I'll do the thumbs up program for ages 5 and up, and I wait for tongue tips until they're around 7 years old and they're mature enough and cognitively able to handle that program and that rigor. Now we have the ability to say, start it young. This program really ranges for the 3 to 6 year old, and we've modified it such that they can handle it. So now in answer to that question, think about, I've got an early intervention program. Also thinking about, does this eliminate the need for tongue tips later as the child grows? Not necessarily, because our goal in creating this program is to make it play-based, to make it exposure, but not expectation of perfection. But hopefully it can maybe reduce the amount of time or the intensity of the program in the future, and hopefully prevent any severity of developmental or growth habits that have developed from that 2 to kind of 6 year age range. So anyway, we're going to start getting into the program itself. Julie's here to help us, thank goodness. Technological support. It's always needed. All right, so I think we're still on the screen, right? But we just can't see ourselves, and you guys can see us, and also a partnership in the screen with what we're going to share with you. What we wanted to start with is, we know that any good program starts with a good assessment. And if you really don't get an accurate or adequate picture of the child presenting in front of you, it will be impossible to tailor and make an individualized plan for that child's therapy. So when Emily and I sat down, we looked at the Tongue Tips evaluation tools.
Absolutely.
And we tried to modify them.
Correct. So you will have access to the Tiny Tongue Tips evaluation tool that we have modified from the original Tongue Tips evaluation tool. So there is not going to be a lot that's different in it per se, but we have added some things that we think are beneficial for the younger child. So you'll notice at the top, if you compare it, we've added a materials list and then pictures that we feel are needed for pre and post program. And then throughout the evaluation tool, you're going to see we've added more specific questions, I think, under each of the areas. And we have added
in the speech sound section, we actually gave you the age range expectations, because sometimes you just like want that for the parents and you want it at your fingertips.
Absolutely. And I think one of the big aspects that we added is
the chewing and feeding aspect of it.
Flipping. So we have an area called eating habits, where we've really tailored it to preferred and non-preferred foods, how the child is eating, kind of their patterns at home, and really kind of delving into have they had prior feeding therapy, which is something that the tongue tips evaluation does not touch on. So we felt that was really important to know kind of that early feeding history as well.
In the articles that are there, that the children with the feeding issues, they're also the ones that likely have the speech issues, and they're the ones that have the breathing issues. So all of these things are tied hand in hand. Sometimes as they get older, some of these things can be covered up, but when they're young, it's just out there for everyone to see.
Yes, so we often get kids coming through our doors where you go through this whole history, and then you ask them if they're a picky eater. Yes, absolutely. Yeah. So you will see that most of the time that a lot of these children do present as picky eaters.
And messy eaters.
And messy eaters, yes.
Okay, so that is one kind of tool that you have in your toolbox with regards to assessment. The second thing that we've done is we've created, thanks Julie, so you're going to move the screen for us, we have created a checklist, a pre and post evaluation progress checklist. And I love this thing. I think this thing is just like, we both used it and found it to be
all the time.
Yeah, it's really super useful.
Mm-hmm.
It's super quick and fast and easy. And I know as therapists working with preschoolers, you need quick and fast because you don't have time to belabor and you need to be efficient. So in the first section, you'll see through the whole program, we've color coded the program. So we'll introduce you to the binder in a moment, but one section is mouth time and it's coded orange. We've basically taken all the exercises in the program and you'll have the child do this as a pre-treatment assessment. And you will note whether their clinical intention is achieved or not, meaning if you're having them do a tongue tip exercise, are they able to elevate their tongue? Now, either at the time of assessment, you can then go in and say, okay, for elevation, could they achieve it? Was it restricted or were they unable to do it? Just as a kind of more detailed assessment as to why a child was or was not able to do one of these exercises.
And you might find with that in particular, it could be due to restriction in terms of the frenum, or it could be more of a muscular issue. So that really kind of teases it out for everybody.
Right. So then that way you have in your mind, is this muscle? Is this a tight oral tether? Tethered oral tissue? What is the real cause? So we do that for the tongue, we do that for the lips, and we do it through all the exercises that are part of the program. As you move on, you're going to assess their breathing capabilities. And with regards to this, you look at what their primary mode of breathing is, what's their resting posture of the lips, have them do a physical activity, have them do some marching or jumping, put on a song, have them do running, have them do something physical and see what they do with their breathing during that exercise. Are they stimulable for proper breathing? And then you say, have they already been to an ENT for clearance of airway patency? And this is really an essential piece because we don't want to, and you've heard me say this a zillion times.
I'll say it a zillion more.
And a zillion more. We don't want to put any child at risk from an airway perspective. And we did just meet at a study group, a myofunctional study group with an ENT who has been getting an influx of patients from us where we want to know if a child can breathe properly or through their nose. And he said that there's no real specific standardized test that they use, that it's a little bit more informal and subjective. But I want a doctor's check of that. I want to know whether the doctor says this kid is cleared for me to start working on it. So in the pre and post, you have they been to an ENT? Emily, you were going to talk about.
Yeah, so the next section you'll see on the pre and post is the gray section for talking time. So this really looks at all of those speech sounds we touched on a little bit earlier. So what we found is, we really need to look at all the speech sounds, and you may feel that you want to do a whole standardized assessment, such as the Goldman Bristow or the CAP or something that really looks at all that. But we also wanted an option for more of a screening tool that's quick and easy and just more of that checklist like we were talking about. So we've created.
No, you created. Okay. I'm totally giving credit right. Emily created. Okay.
So I created what we're going to call the speech sound screener, and we're going to be putting this into the portal. It should be coming soon if it's not there already. And so what you'll see is you have a checklist of sounds in order, and the screener follows that to a T. So your first row will be for your S sound. You'll have initial, sock, medial, pencil, final, house, and that will be the structure for all of the sounds that you have listed. And so you're just going to check if they're in error or not. And then if they are in error, you're going to go back, as everyone would probably do, and check for stimulability. Are they able to produce it in isolation or in any context? And that just gives you good data to know where to start and kind of where to go forward.
And it should be noted that we really didn't pull every speech sound out,
Correct.
but we pulled out the speech sounds that are most at risk for a myofunctional disorder.
Yes.
So those sibilant sounds, the alveolar sounds, the palatal sounds,
Yes.
and that neutral R that we oftentimes see. So yeah.
Absolutely. So, and then the last section you'll see is sip and snack time. So it's orange, but a little bit lighter orange. And really, this is the last part of our program that we'll go through with you later in the manual. But for your pre and post, you're really going to want to look at the child's chewing patterns, their swallowing patterns, and their food repertoire. As we talked about earlier, we often see kids who are picky eaters, and that may look different. They may be restricted in what they're eating. They may be eating soft foods only. They may have a well-rounded diet. We don't know. Or there may actually be nutritional concerns. So really, I think the key point to take away from here is we want to watch them swallowing saliva, liquid, and we want to see at least 3 different consistencies of food to really measure, soft food, crunchy food, chewy food, and see if there's a difference in what they're able to do.
Yeah, I think that's a really valid point. I think so often I think back to my days where I was doing bedside swallowing evaluations and I had to hit my purees, my mechanical soft, my, crunchy solids, and to determine if somebody was safe. And I think it's no different with these little ones.
It's no different.
It's no different. And some of them, it's just exposure that they haven't really been exposed to some different consistencies, and some of it is that they're picky because of a myofunctional issue.
Yes.
So we have to tease that out.
Yes.
All right, so that's evaluation.
Yes.
Check.
We love this. Okay, perfect.
In conjunction with it, with that pre and post treatment, we actually created a picture page. So it looks just like that chart. I don't know if Julie has access to it. It's not a big deal. It literally,
perfect.
Love you.
Thank you.
That's it. It looks exactly the same, but it tells you what pictures you can take before and after. So in the tongue posture pre-treatment section, you might take pictures of their full face. You might take pictures of their lateral body, their smile, a close-up bite, pictures of their palate, pictures of their frenum. So I think it's really nice to have these pictures because then you can take the post. Emily was just showing me pictures of a young man that she had in therapy, and the pre and post pictures in a 6-week time period were drastic, glaring. This is without orthodontic intervention.
Yeah.
So it was really awesome to see, but it's just as important in these little ones. Breathing, you might just take a facial posture at rest to see what kind of breathing they use.
Yes.
If you can get a video for their speech sample, awesome.
Absolutely.
If you can get a video of their chewing and feeding, amazing. Just for comparison's sake. So we have it written as a chart. Use it as you wish or your desire. Okay, so now we want to get into the program itself. Our little baby of tiny tongue tips.
Julie's going to switch us over.
Yeah. And while she's switching it over, I just want to tell you that what we've done is we've created this document in a format. It's called a Canva. And through the membership portal, you can access it and print it out. It is 250 pages. Well, I'll say it's actually about 200 pages, right, Julie? Excuse me. And about 50 pages were produced through a program called Lessonpix. Now, they can still hear me, right, Julie? In Lessonpix, Emily had an account.
Yes.
And if some of you might be familiar with it, some of it you might not. It is amazing.
It's incredible.
It allows you to create all different materials at a moment's notice for different speech activities that you might want to, or sounds that you might want to target.
So I think of it,
Go ahead, go for it.
If you're familiar with Boardmaker, I find it to be a glorified Boardmaker with many more capabilities, and I find the visuals to be more appealing.
Yeah, really.
And also it's Lessonpix, Pix.
Yes.
If you want to look it up.
And so per Lessonpix contract or rules, we are not able to digitally share those 50 pages with you. We've created them, and what we did, and we're grateful that we're allowed to do this via Lessonpix, we made them public access available to you. So if you have a Lessonpix account, you can go onto it, look up Simon Says, and 50 different options will pop up. You can just print them all out and put them into your binder.
And that would be located under the Sharing Center, I think it's called, on their website.
Thank you.
Those are all Simon Says TTT.
They're all listed under Simon Says TTT, and then it might say D or S or R, and those activities will be listed there. If you don't have a Lessonpix account, you might want to think about it. I think it might be $30 for the year.
Yeah, I think it is.
Go in, you might become addicted, you might love having it and use it for your practice, or you might just go in, choose to download and use and print out the items, and then at some point cancel it if you don't find you're using it for any other purpose. But we wanted to tell you that you'll see those papers in the Canva, but they're not available on our portal. You'll have to access them separately. So welcome to your Tiny Tongue Tips program.
Yep.
We're super excited. What we've done is we've taken these 100 or 200 pages and we've printed them out. I think you guys can see me. And we've put them in this binder. And we've separated them by section based on the manual itself, mouth time, talking time, breathing time, sip and snack time, and then forms, like your assessment forms, and then your cards, which are your picture cards that we've taken, and you'll see they're rocking. I'm a little biased because it's my kids and my nieces and nephews.
They're adorable.
But they're really good. So in this manual, Emily, I'll let you explain kind of how it's mapped out. It's similar to tongue tips.
Yes, so it's similar to tongue tips. So what we've done is we've given the intro page like you have for tongue tips, and it really kind of, this is what you can provide to your parents to give them an introduction of what is to come. And as Jay had touched on earlier when we were talking just about what Tiny Tongue Tips is, so it really is about a play-based program, and we go through 5 areas. So we target what we call warm-up time. So that's getting all of the articulators ready to work, kind of giving
A wake up.
a little wake up to everything that we're going to be doing. So we have warm-up time with different activities. We also have mouth time, which is really the modification of tongue tips. So we've really looked at all of those exercises, determined which ones can our littler ones do, and we've even added a few that we'll be sharing as well.
Yeah, kind of to encourage that intraoral suction.
Yes, and so what Tongue Tips doesn't have right now that Tiny Tongue Tips does is what Jay was talking about the cards. So we have visuals of all of the exercises that you can use with your maybe the understanding isn't always there. So then the next section that we'll go through is breathing time, and this is really Jay's baby. So
yeah, from all my time in my Buteyko breathing class, you guys know if you've been to my seminars that we do a lot of practice with breathing, and we know that reestablishing nasal breathing is an essential part of a myofunctional therapy program. And we know that we're born nasal breathers, and something makes us not be a nasal breather. So if we have the A-OK and the approval from the ENT to move forward with that, we are going to work on training our children to breathe through their nose. And we do that through the breathing time activities. And we've tried to make them as fun and appropriate for children as possible.
My kids love them.
Yeah, and then go ahead.
Oh, sure. So then the next section after breathing time is what we call talking time, which we've touched on a little bit, which really focuses on 2 key aspects. So we have what we call auditory bombardment activities, which just gives the child an awareness of what the sounds are that we're going to be working on for that session. And then we have many ideas for different activities for every sound that we have targeted. So we hope you find them useful. They're just ideas, and we have provided some materials that you can use, but this is the chance for you to just be creative and really do your SLP thing. And
I find them particularly useful because I literally follow them like a rigid book. Because when we teach in the seminars and we talk about talking time in our adult tongue tips program or our adolescent older child program, I basically say, like, the therapy's up to you. I admit I'm a more boring therapist. I do play games, but I'm kind of a drill-based therapist. And when it comes to these little ones, they don't want that, right? They want it to be fun. So we loved listening to Emily create all these amazing, fun, interactive games and activities that you guys probably all do, but me as an adult-based speech therapist really did not. I shied away from them and not used them for many years. So I'm grateful for them. So I use them as they're there. But many other people, you guys have your whole bag of tricks. You have your arsenal that you already have created for your years of doing therapy. So
absolutely.
The last section is
sip and snack time. So most often it's the favorite aspect of the whole program for all of the children. So we focus again on 2 things. So we really work on chewing skills, and we have a wonderful Inner Circle member, Mandy, who helped us in this area with her song that we'll show you later. But really working on chewing bilaterally and really getting that tongue moving for that lateralization. And then we also just focus on that food repertoire, expanding exposure. And then, based on that, I don't know if anyone's familiar with K2Me and the sequential oral sensory approach to feeding, and how she really follows what we call food chaining. So really linking preferred foods to non-preferred foods or to novel foods by different categories. So there's a whole section in that we'll go over too.
Perfect. Okay. Julia, so I just can just hit this to the right. I can hit this down.
Scroll up.
Oh, I scroll.
Yep.
Even better.
Oh,
okay,
perfect.
here we go.
There we go.
Okay. So, welcome to warm-up time. What we want to do is just kind of take you through some of these exercises and activities that we created. And you can see Mr. Mouth is right here.
So he's our favorite tool, and you can get him on Super Duper Ink. I think he's about
on Amazon. You can actually,
you get him on Amazon?
Can't you get him on Amazon or only on Super Duper? I'm not sure.
So definitely Super Duper. I think he's about $40.
He's an investment.
I love him,
Yeah.
but there are different options too if you don't want to invest the $40, but he's a great tool. So as you'll see, we have, do we want to just flip?
Yeah, let's just do it. Here's the
Okay.
Mr. Mouth song.
Oh,
This is awesome.
are you going to make me sing?
I'll sing it with you.
Okay.
We'll do it together.
So this is just a way to introduce all of the aspects of the mouth that you're going to be talking about with your kids as you go through these programs. So,
Let's make me Julie.
okay.
Okay.
In our singing. Here we go.
Mr. Mouth is here today. Hello, Julie. It's time to play. He has 2 lips so he can kiss.
Pardon me.
Mwah! Great. And a tongue so he can lick. Mr. Mouth has lots of teeth. Open wide. It's time to eat. And the kids love this. I've now watched Emily do this a bunch of times. I've done it with the kids. It's literally their favorite time, and then they just want to hold it, play with it.
Play with him. And then what you can do to go on from this activity is I then ask each child, okay, what do you want Mr. Mouth to do to them? So Jay may say,
I want him to kiss my hand.
right. And so then you can go through with each child, or they can do it to each other in the session. So you can just make it what you want and make it a lot of fun.
Perfect. So that's just one activity.
Oh, here he is.
There he is. You can see him doing that to Brody, Sydney, and my daughter, Devin.
Adorable.
Yes. Hello Head Bobs is a great warm-up activity to try to introduce some nasal breathing and to try to clear their nasal passages. So many of these kids come in with allergy issues or with stuffy noses, and we know from the Tongue Tips program, you've learned some of my breathing, that those unplugging the nose exercise is a great way to kind of open up those nasal passages. So we do something similar with Hello Head Bobs. So we tell the child to take a little breath in, a little breath out, and plug their nose. We make sure their lips are shut, and they kind of bob their head from side to side. You can see Devin going side to side or up and down. And we all do this together. And when they feel the need to breathe, they let go, keep their lips closed. That's the key, and continue breathing. We have to do it at least 3 times to really get that clearance. Practice this yourself. We practice it in our seminars. Practice it yourself so you get comfortable doing it, so you get comfortable teaching it to the kids.
I just find that I tend to do this by myself anyway.
I wake up now and do this. I find it to be useful, right, in life.
I know.
Instead of a neti pot.
Yeah. Oh, no.
I don't use those. Okay.
Oh, awesome.
Good
Okay,
old-fashioned
so
bubbles.
who doesn't love blowing bubbles? I brought my bubbles that I love to use, the little Fubbles, and I got these on Amazon pretty cheaply. They come in maybe like a 3 or 4 pack. I didn't actually fill them up today, so I'm not going to blow you some bubbles.
But we know. We're speech therapists. This is about as early intervention as it gets, right?
So really for the activity for blowing bubbles, we're focusing on, getting that lip rounding, modulating that airflow, really strengthening those core abdominal muscles. And then we also want to work on, getting our kids up and straight and getting that good breathing. So you can do it 2 ways. You can blow the bubbles to them, work on a little language, and then you can go around and have each of them blow the bubbles back to you.
All you preschool experts out there know this. You've done this for years, right?
You all have these.
Yes. The cheek roll is just another way to warm up the musculature, the facial musculature, and especially those that we use for chewing. So the buccinator, the masseter, the zygomatic muscles. So all you're basically doing is taking your hands and kind of rubbing. Oh, this feels good. It's so warm in here. Just warming up those facial muscles. There's a little blush just to add to the redness in here. So just another great warm up. And, you know, I think it's good for children to learn about tension and how we relax muscles and how we tense them. And it just gets them to increase their awareness. You know, we did that session the other day with the 3 kids, and I was in awe of watching them become just aware of their lips, of their tongue, of their mouth, of their facial muscles. So a lot of this program is increasing awareness of what's supposed to be and what maybe is not.
Absolutely. Oh, our next one, motor mouth. So you also might know this as lip trills. So this is really that motion, and it's really designed to wake up and activate those labial musculatures. And as Jay had touched on before, you know, the muscles like the orbicularis oris, again, for lip closure and competence, which some of our children are really lacking because they're chronic mouth breathers.
Yeah, or they have the low tone of their lips and their mouth just hangs open all the time. Well, let's get the contact together so they feel what it feels like to have their lips actually meet together.
Right.
And then alternatively, I've just recently had a child who's just very hypertonic, and she is so tight all the time. It took us 4 sessions to accomplish a motor mouth.
Wow.
Because she was so tight, she would just, and she could not relax those muscles in order to get a motor mouth properly. But then she came in the 4th time and said, I did it! And we had a little celebration. So, you know, it's sometimes, again, in the assessment, we note these things so that we know what to expect and not expect in our sessions. But motor mouth is a great little easy warm up.
Correct. Oh, great. So that kind of wraps up warm up time.
Yeah. You know, I wanted to, this is kind of at the end, but I feel like they should see what it is.
Can we have Julie maybe?
Yeah. Well, yeah, Julie, if I hold this up, will they be able to see this if I hold it up? The lesson plan. I'm just interrupting it because I think it's such an essential part of the program.
Yes.
But what I wanted to show you is that we created a lesson plan. This thing rocks. It's really
Oh, great.
Oh, there it is. It's right there. It's really so cool. We took the 5 sections of the binder, the warm-ups, the mouth time, the breathing time, the talking time, and the sip and snack time.
All color-coded.
All color-coded and visually looking just like your pre and post assessment. And we created a lesson plan. Now, we've taken this, and Julie even has videos to show you how to order these in notepad format so that you can just rip off the pages for each client. So in my mind, I envision you can do this program individually.
Absolutely. Or in a group setting for sure. As we talked about, we just had a little group of 3 children.
Exactly.
You can have more than that.
Exactly. And so if you're using it in a group format or even individually, I fill out one of these for each child every time they come. And I circle what activities we did. So we just covered warm-up time already, but if we did I just choose a couple per session because it's too overloading to try to do all of them.
Probably 2.
I think 2 is a good
2
number. Good. So that you have to make sure that in each session you're getting through all 5 sections.
Right.
Okay. So
don't spend too much time in one section because time can really get away from you.
But if you have a group and maybe one person is not working on nasal breathing, they can be the example for the other ones that are mouth breathers, but they don't necessarily have to be doing this for homework. They can just participate in the activity and join along.
Correct.
Okay. So we just circle 1 or 2 of what we did in our warm-up time. Now in our mouth time, all 16 exercises are listed.
Yes.
And I just do an average, usually about 3.
3. Yep, we do about 3.
Yeah, and we just check them off per session of what we did. Okay, and then there might be pages that you attach to this sheet. So I rip it off. Maybe I attach it to some of the activities that you'll see later from Lessonpix that we created. But this tells the parents what you worked on and reminds the child of what they worked on. And so for each section. So now, Julie, we can go back. Well, I guess I could just quickly say in breathing time, we have the 6 breathing exercises. Right. In talking time, there's all sounds that we potentially could be working on. And in sip and snack time, we write down what we chained. Back to the manual.
All right.
Thanks, Julie. Sorry about that.
So next we're going to be talking about mouth time. Yes. And I think we have 16.
Yep.
16 exercises that are targeting the tongue, the lips, and do we have any for the cheeks?
Yep. 2
for the cheeks. Perfect. So really targeting those orofacial muscles that may be compromised due to an orofacial myofunctional disorder.
Yeah, or tethered oral tissue.
Exactly. And so a lot of you who are familiar with tongue tips are going to be familiar with these exercises in tiny tongue tips. But we're going to go through each one for you. There we are.
We're back. Okay.
Okay. So first, we're going to
Scroll.
scroll.
Yeah. Put that closer so we can reach it.
So in the back of your, are they located in the back of the manual?
In the back of your manual are all your cards.
You're going to have options to print the pages, and I have laminated mine, which makes them pretty durable. So I think
they'll be printed when they print out in this size. You can see in the binder I haven't laminated these, but Emily has already laminated them.
Yeah. So I just find it nice to have them cut out and laminated so I can reuse them over and over.
And then you even, like, because you're awesome, you put a little Velcro on the back, and then you even put like a safe paper clip so that you can use them for different activities, whether it's a felt board or a fishing game.
Magnetic fishing game, lots of different things. I mean, anyone who's in preschool knows the love of Velcro, so I'm sure you will do the same thing. So just know you have these in addition to what you have in your manual. So I think we'll just get into it.
Yeah, let's do it. So let's just run through the exercises we're not going to spend much time on because you already know them. You know them from your Tongue Tips program. We have coined this term the bump. You know, some people call it the magic spot. I don't know what else it's called. The alveolar ridge.
Yeah, the ridge.
I don't know. I mean, incisor papilla. I mean, it's been many things that it's been coined by different practitioners out there. We called it the bump because we think little kids understand that there's a bump behind your teeth on the alveolar ridge, and they can feel that with their finger, with their tongue, etc. So you'll see throughout the program that we call it the bump. And you can use a tongue depressor, you can use a sticky spot, you can use a Z-Vibe,
Z-Vibe, peanut butter, Nutella, anything that you think of.
Yep, and all they're going to do, just like in our regular program, is lift up their tongue 4 times to 6 times.
Yes.
Nothing different with that.
So if you want to scroll back, actually, so I think it's important to point out for tiny tongue tips at the bottom, we've included now the clinical implications for each of the exercises for you to refer back to. You know, you might have parents say, well, why am I doing this?
Yeah.
So you're going to have the exact language to use with them to tell them why.
Yeah. It reminds us too. Yeah. And then when we were going through it, it's like, yes, of course, this is why we're doing this.
Yeah.
And of course, as Emily mentioned too, you have the name of the exercise, you have a visual picture of the exercise, and we also have written descriptions of them.
And we have the dauber pages.
And we have the dauber pages, which you'll see when you print them out. Here, I'll open them up to show them to you. So they're right here.
This you can use within the session, or this can be used for homework. But it's a visual which we've taken from Lessonpix, and we've adapted it into a dauber page that you can put stickers or use your bingo markers or anything you really want to do just for additional practice.
Yeah, I remember Jenny, one of our Inner Circle members, we were joking, I was having a young child do the tongue tip exercise, and I was basically like, okay, do it. Awesome job. And again, great. And again, terrific. And then Jenny posted like a picture of some dot picture that had like 50 dots all over it, and I'm like, oh my god, that was like so much more fun, so much more age appropriate. So thank goodness for preschool speech therapists who just know how to do it right. So Waggle Spot is the same exercise that we've done in tongue tips, where you wag your tongue from side to side and then lift up to the spot. Again, just key to keep in mind is to make sure that these children try to stabilize their jaw. And if you need to use either a bite block or some people use like oral placement tools from like Talk Tools, or
I use my mirror a lot to
some people use prompt kind of approaches. I just kind of use my finger and I touch the chin so that they can feel if it's moving. We use mirrors.
Yes.
Whatever you want to use. There's Brody Boy. Sweet Devin. So tongue point is an exercise just to narrow the tongue as you stick it straight out. Again, beware of the kids that are tied, you know, these tethered oral tissues that you see in these heart-shaped tongues.
They may not be able to, they
might not be able to protrude. They might not be able to retract. Again, if anybody has taken the TOTS class, you'll see that if there's dimpling in the middle, it's an indication of a posterior tie. You'll see if the heart shape, then it might be more of an anterior tie, if they're unable to get good range of motion. So again, in the assessment, these are the times that we really take notice of these things.
Oh yes, so tongue tickle. We call this tongue trace in tongue tips. So this is where you're bringing the tongue up to the bump, and then you're going to draw that straight line back on the roof of the mouth towards the throat. So
they all want to protrude and dissociate their jaw and bring it forward.
Yes.
So we would try to do the best that we can to kind of keep that stable, whether we need to use a bite block.
Right.
And we wrote here that for the older kids, you can extend it and have them write their name on the roof of their mouth or the alphabet.
Yeah, I do that a lot.
I do that post phrenectomy a lot.
Yeah. Oh, me too.
Just to kind of keep their tongue moving as much as possible.
Excellent.
Strong paper is the same.
Yeah.
I mean, I don't think we should take too much time. I'd rather tongue click.
Also the same. So we like this one.
Yeah, I love this one. This is
so the tongue cave competition. So really, it's having the child go into that click posture and really holding that tongue flat to the roof of the mouth. And then if you are in a group setting or even with yourself and
we could have a competition,
right,
and we could
say, hold it the longest.
Ready, set, go.
And then I would always beat Jay. So
she can beat me. It's fine. So seeing who can hold it the longest, and as you can see, Brody and Sydney, this is my niece and my nephew, they like actually got into it, and they were seeing who could hold it the longest. So it was super cute.
So who won?
I'm pretty sure that Brody won that one, but you never know. Sydney could have pulled it out in the end. Two bounce is the same.
Yep.
As in your regular tongue tips program, just building up the musculature in the cheeks for chewing.
Lip squeeze is also the same. So squeezing and rounding those lips together as you're going to give a kiss.
Yes. Paper hold, again, very similar to the tongue tips program. Just again, getting those lips to have contact and being able to hold them stable together.
Really working on that stamina.
Yeah, that stamina, how long they can hold it for.
So straw hold is a little different, that it's not in tongue tips, but just having the straw and holding it steady in that rounded position for about 30 seconds and just seeing, for the stamina purposes and competence of those lips.
Right.
So
yeah, and this might be like your stepping stool. So hierarchical, you start with your straw hold, and then you find that your child might not be able to do it, and then you move up to straw paper. Lip pops are exactly what they say they are, and similar to what we've done before. We have it lip press and pop, I believe, in the tongue tips program, but just competence of those lips. Smile big is actually not in the tongue tips program, but I think it's such an essential part. I think of one patient who I just have every week. Yeah, and he is so asymmetrical. And again, this is a story where this kid had been in speech therapy for 2.5 years, working on an S sound. But the therapist knew. She knew that the child needed more, and she knew that she was missing something in a myofunctional regard. Sent him to me. Turns out the kid was labial tied, lingual tied.
Oh my goodness.
And incredibly asymmetric, and it wasn't skeletal, it's muscular. So we released the tongue, we released the lips. We actually joke that his labial frenum actually grew back, and he has to go back for a revision, and the doctor who did it has never seen that before, so we joke that he's like Spidey. But the lingual release I hadn't initially
Absolutely.
Lollipop lick, it's a tongue resistance. You can just kind of push against it. You can also try to lift that tongue up. So whether you do it with actual lollipop.
Well, I think this is also similar to tongue blade push.
Yeah.
But yeah, so you can use an actual lollipop. Dum-dums are perfect. We also have flavored tongue depressors.
Tick
tongues. I think we have one.
I don't know if I have one in here.
Julie, can you grab my ombre bag? And
yeah, those are awesome. They're really, really great.
And we got them on Amazon.
And Super Duper has them as well.
Oh, do they?
They do. And another thing that I've recently done
There they
based
are,
off
flavored
very
and
good.
colored.
Based on Shar Bashart's some of her podcasts I've been listening to, is you can take a toothette,
Mm-hmm.
spray some candy, 2 tarts flavor.
And then you can work on really isolating as they get better at it.
Perfect. Fishy Face is not in the Tongue Tips program. I think this is an essential part of Tiny Tongue Tips program because so many of these kids with chewing and feeding issues do not have a good intraoral suction, which we know is essential for proper swallowing. You get to put on your therapist hat and you get to think about all the fun ways that you can introduce these exercises to your clients. So like I think of Mandy, one of our inner circle members who's a feeding and chewing specialist, and she has a little mailbox in her office, and the kids would come in and grab their exercises out of the mailbox so they knew what they were going to be doing. So we tried to come up with something similar, just a few activities, but we know you guys will have many more.
Right.
So
and
these were the...
And as Jay was talking about her doing just exercise, now we're going to make it a little bit more fun. You can roll the die and then complete the exercise that's on top. So that's one idea. This one's my favorite.
Yeah.
And
we have, what did you do with our little guy? We're going to post a video of Emily doing a session with a little guy, chronic pacifier user who just recently gave up his passies. What did you use, Mystery Box? You did fishing with him.
I think I did fishing.
Yeah.
Yeah, and I'll show you the fishing. Yeah, we'll just go through these 3, and then there's, I think, a different page as well, and a video. But for everyone who knows or doesn't know, the Lakeshore Mystery Box, you can use your own shoebox and create your own, I would think. But putting your exercises in the box, and they can reach in and they feel for it and they pull one out. They love it. You make it such a fun game. So we love the mystery box. And you can also use this for talking time, which is one of my activities as well.
Fishing is a good go-to.
Fishing, as Jay was talking about, I have them all ready. I just tape paper clips on the back. And then you have your magnetic fishing rod, and they go and they catch their exercise.
Perfect. Easy peasy.
Love it.
More activities that we have is to actually hide your mouth time cards around the room and go on a scavenger hunt for them. You could do just a good old sensory search where you put in either in a sand bin or
sand,
beans.
Anything.
Many of you might have these like in your classrooms, or you might have them in your office already.
So like for winter time, I have fake snow that I put a lot of things in. Yeah, so you can change it by the seasons.
Awesome. Monster Mouth, this was based off of a box that you had decorated, correct?
So my first, no, I was actually in college when I was in grad school. I took a shoebox, painted it blue, cut a hole for a mouth, and made it into a monster, and then they got to feed the monster. I'm sure you can buy monsters that you can feed. Yeah. There's like Feed the Woozle, I think is one of the games. But the kids go crazy over feeding the monster.
So cute. So such fun ideas, right? And can't you imagine 3 kids, 4 kids in a group all taking turns? They would love it. So that's really the end of mouth time. And
Yes.
that's really a big part. Well, actually, each one is kind of evenly distributed. I'd say warm-ups is a little shorter than most of the other sections. But then we get into breathing time. So we know our ultimate goal of breathing time is to reestablish nasal breathing. Okay, because we know that makes us healthier. We know that's the way that we are born and supposed to stay. But that something makes us a mouth breather. And we know that these are many things, whether it's a tethered oral tissue, a high arched palate, whether it's due from enlarged tonsils or adenoids, whether it's from some kind of structural abnormality. So for all these reasons, we know children from a habit. For all these reasons, we know they become mouth breathers. And just say that their face grows and develops. We know that it affects their dentition. We know that it affects their speech and swallowing. So we know all these things are so very interconnected, and hence why early intervention, teaching them what's proper. Sometimes if you know better, you do better. I mean, I can think about my niece is 8 years old. For no other reason other than just having some enlarged tonsils. She was a mouth breather,
and that exacerbates the enlarged tonsils by continuing to breathe
just the inflammation of the tissue. So we just talked about how to close her lips, and then we set goals. Okay, close them when you watch this YouTube video, close them when you're doing this dance, close them when you're doing your homework, and now it's just done. It's just better. Okay, awesome. So we've created some activities that are a little bit more fun so that you can work on belly breathing. So one is just doing good old belly breathing. And we just did this in our group the other day where we had the kids lay down on the floor.
Pretend to sleep.
Pretend to go to sleep. I said, please excuse me if I actually fall asleep. I was up in the middle of the night. And we put one hand on their chest and one hand on their belly. I mean, this is good old fashioned grad school. I know all of you in your graduate programs learned diaphragmatic breathing.
Yes.
And with little ones, they can do the same. Just have them be aware of what hand is moving, what hand is not moving. Okay, try to only isolate and just move your belly.
And then we also put Mr. Mouth on their bellies to see if they can make him move up and down.
Perfect.
Which was so much fun.
Exactly. Speedy, slow breathing is actually an effort to help the child learn how to regulate their breathing. We know that people say in our society that we overeat. There's actually speculation among the breathing community of the world that we overbreathe. If you actually watch YouTube videos, and we've done this in our seminars, listening to Patrick McGowan talk about what stress breathing, what panic breathing, what anxiety breathing feels like, it is faster, it is shallow, and it is quick. Or it's big sighing. Right, and you can't catch your breath. So what we're trying to
typically
teach,
probably through your mouth,
and most always through your mouth. I mean, how many years have we gone to yoga where they're like in through the nose, out through the mouth, but you're releasing all that valuable carbon dioxide that you need to harness and harnessing that oxygenation to the blood cells. So for all those reasons, we try to teach these children how to regulate it. And one activity is speedy and slow breathing. So I have used either a rabbit or a turtle. We have them either hold it or maybe they're laying it on their belly, and we demonstrate the difference between fast breathing and slow breathing. So easy enough, right? One fun game that we do is red light, green light, right? Who doesn't like lining up and racing and running and getting out all that energy? But of course, we're doing this with your lips closed, breathing through your nose, hopefully with your tongue up on the roof of your mouth. Marching is another great one.
I even do this with my adolescent clients.
Right?
Yeah.
Perfect.
March up and down the hallways.
Right. We know per tongue tips, we have some more kind of advanced breath holds and walking with breath holds. And I send them off to do their soccer practice, doing their warm-ups with proper nasal breathing. But for little ones, they just need to practice feeling what it feels like to do physical activity with their lips closed. They've not done it before. My favorite is I had a little 6-year-old come in and I said, we're going to do marching today. We're going to march with our lips closed. Pick your favorite song. I'm going to put it on I'm going to put on the music. And she's like, I want Ring of Fire.
She really does Ring of Fire.
I was like, really? How old are you? And she's like, I don't know, it's my favorite song. I was cracking up with her mom. I'm like, now I know you guys listen to it at home. So we marched to Johnny Cash. We marched to Ring of Fire while she breathed through her nose. And so they even just did that at home. It was
work on breathing with some of my clients. For the first time, I'll say, how does that feel? And they always say, that's weird.
Yeah, it's like so weird, so different.
But they're becoming aware, you
Yes.
know, through all of the exercises that we're giving you today. But there's many other things that you can do to incorporate nasal breathing with your clients.
And I think the more that you do something, the more of a habit it establishes. Like I even think about these breathing exercises. When I first went to my breathing program, I realized I really was mouth breathing during my exercise class.
Oh.
So I started taking different sections of it, and I'd be like, okay, during this warm up, I'm going to have my lips closed, breathing through my nose. Now I think I'm the only one in the class. I look around sometimes, I'm like, I am the only one breathing through my
I
nose.
don't think
the
I
whole
could do that
time.
during cycling, though. I think
No spinning, I'm for sure breathing through my mouth when I spin. But during bar class, no.
Yeah.
Jumping, you know, we have so many fun things. And you probably have a mini trampoline
Oh,
where you have
yes.
those bouncy balls that you're using for core strength. So why not use it to help them breathe through their nose?
So it's also really about getting the heart rate up, you know, and then trying to regulate as well. And, you know, versus just at rest.
Yes.
And trying to breathe through your nose too.
Great point. Big, small breathing. Again, we talk about this over breathing. And so we try to get them to feel what it feels like to take big breaths and to take small breaths. And are we able to have them figure out, can they still get adequate air and adequate oxygenation with reduced volume of breathing? Yeah. Very cool.
Absolutely.
So we've taken these exercises and we put them in kind of a lesson format. We have that for all the sections. I don't know why this is here.
Right. I feel like this
it's
should
usually
be,
at the end.
Yes.
But we're just showing that it's in the binder. Again, when you print out this off the portal, everything might not be in proper order.
Right.
Make sure you create your sections of your assessment forms, the actual manual, mouth time, talking time.
And you might want to keep these at the beginning of the section or the end. I find that this is really helpful for parents, and I will often send these home at the beginning of the program just so they have that information of what they need to do when they are practicing at home.
Sometimes when I look at this, I'm like, there's so much content here, guys. This is the most awesome program. It makes me so excited for you guys to use it.
So
and we want your feedback.
Yes,
we want to know, you know, what your results are with your kids, this early exposure. I think because we're not taught about myofunctional disorders, or most graduate programs don't teach it, and yet it affects 80% of the kids, over 80% of the kids that we're seeing for speech sound errors and for speech issues.
Well, what about your chronic lisp kids? You try. I've had to let kids off my caseload because I couldn't help them without knowing, well, I'm missing something.
Yeah, that underlying issue. And I think coming back to like the little ones, what if we were able to address some of these basic myofunctional issues at a younger age? Would that help them either be done with therapy later or not need it later? How cool is that?
Absolutely.
You know, this is fun. So talking time.
Okay, so we've touched a little bit on this. And so really in talking time, again, to reiterate, we're not targeting all speech sounds. We're really targeting ones that could be impacted by these orofacial myofunctional disorders. So to really go through, we're doing S, Z, T, D, N, L, so all your alveolars, your palatals, SH, CH, ZH, J, and then that neutral R, which we see
with all those suckers and all those tethered oral tissue kids, and you know, we talk about that a lot.
So, you know, as we've talked about, depending on the age of the child, you know, it's not necessarily about perfection in terms of production, but it might just be more exposure and practice. But if they are stimulable, obviously work on the accurate production. And so it's going to take you through two areas, which I touched on, auditory bombardment. So each sound has, and it's
so the way that, so this is how it's going to be organized for you guys as we go through it.
Do you want me to flip back or stay?
I was just going to say we can go through it as we go.
Okay.
But what we've done is we've created auditory bombardment. So that is what we need. Where would those be? Julie, how can we find the auditory bombardment pages?
We already done.
Okay, you are. See, she's already ready. This is Julie.
So we usually start with the auditory bombardment activity, as I talked about earlier about, oh, perfect.
They're at the end there.
Oh,
There's all of our pages.
Yep. Oh, perfect. Here we go. So this is just, they don't have to participate at all. They can just listen. They can participate, but each sound has a song based on the sound. So our lovely Simon the Snake,
yes,
Simon says.
Love it.
So each one tells you how to sing the song. Are we singing?
We can sing one, maybe.
Okay, you want to sing this one?
Sure.
Okay. Simon the snake goes hiss, 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 hiss. Simon the snake goes hiss, 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 slithering on the ground. And here, I'm gonna pull
see, we have a tool. We for sure have a toy in here.
Great.
Can you reach it?
Oh, I got it. Okay. He's somewhere in here. Oh, there he is. Great. Oh, thank you. Sure. Okay.
Oh, cute.
Look, so
Right?
I have my little finger puppet. You might have a little stuffed animal. You might have
Sure.
anything. So always using props with our little ones they love. So this is my Simon. So that's our auditory bombardment.
And there's one for each sound. Oh, so there's one for each sound. So you have a song for each one. And I think we even said that you can look it up on YouTube.
Yeah, so there are these great videos. So they're letter S. They're really fun. They go through the actual letter, the sound, and then it uses some words at that start with that target sound. So
yeah, I think the whole idea is we're exposing them to what this sound should sound like, what it should feel like, what it should look like. In addition to, we're building up muscle strength and we're building up proper placement. So for all of those things, we're kind of creating a good foundation for having proper speech.
And so we kind of, if you want to scroll one.
Yeah.
So as we talked about earlier as well, each talking time sound will have, I think, 5 activities, and then a handful of the activities, we've created the materials for you. So you will find those on Lessonpix ready to print.
So you can see what they look like.
So here's a bingo game. And then for Z, there's the auditory bombardment. You have a hidden picture.
Drawing the
coloring the zebra stripes for all your targets. Different board games. So there's a variety of different activities you can just print and use. So we want to make this easy. If you don't have time to prep, it's already there for you.
And I'm going to bet that so many of you, because you've been working on these sounds with your kids, you probably have an arsenal of therapy tools and activities that you already have.
Absolutely.
Hey, share them on the Inner Circle page. Tell us what you're doing and share them with the community, because we all want to see the amazing therapy that you guys are doing, and hopefully using while you use the Tiny Tongue Tips program. It's a lot of T's.
Sorry for all the scrolling, but here's just an example. Each sound, so here's CH, and it gives you different ideas. And it tells you in italics next to the ones that have the materials provided.
Okay, so we provided materials for at least 2 of the activities, and the other 3 are just ideas of things that you can do. So hopefully that means for every sound, you've got 5 possible activities that are just handed to you, and the rest you can do on your own.
Absolutely.
So we have that for each sound. You see it for J, you see it for the R, and then that brings us to sip and snack time.
Yes, sip and snack time.
The favorite time.
Yes. So, clinically, when we think about sip and snack time, it's really for us to work on the orofacial musculature, and we think about proper chewing and, of course, proper swallowing. But on the other end, we also think about that exposure, and we know that, for kids who have trouble trying new foods or accepting new foods, we often see it takes 10 exposures to one food to even have them accept it.
Right.
So we want to continue exposure, and that's why it's really important to have the parents on board and use your lesson pad so they can practice those foods at home that we did during the session.
Even with some of the adolescents I've seen, they want to expand their repertoire, and then we give them an assignment that they have to have X number of salads through the week before they come back and see me. And it works. It just does.
I had one client who, she's 17. She said, I hate avocado. I hate everything about it. I hate it. I was like, well, how many times have you tried it? Well, none.
Yeah.
And now it's her favorite food.
And so healthy for her.
Yes.
It is soft, but it's still a healthy food.
So there's the introduction to sip and snack time.
I think an essential piece of understanding sip and snack time is understanding a chewing hierarchy. We have to understand normal to understand what abnormal is. And I think what we did, we tried to compile a chewing hierarchy based upon the Robin Merkel-Walsh and Lori Overland's, their TOTS
and Kay Toomey
book, and Kay Toomey's sequential oral sensory feeding. And we utilized some of what Alex in our Inner Circle gave us, and Mandy Hart was an essential part of kind of putting all these pieces together.
So we didn't, it's not necessarily a comprehensive list, but we thought we would pick out the essential aspects of the chewing hierarchy that we felt targeted what we were doing.
Yeah, and I think it's just important to recognize when we should expect certain things. So understanding that tongue lateralization really starts to come in around 7 to 9 months. You know, that around 10 to 12 months, that gag reflex is moving back a little bit. How interesting is that? That we start emerging with a rotary chew around a year to 15 months. How awesome is this? Tongue retraction for swallowing at 18 to 24 months. So when we see that persistent tongue thrust, and we're seeing these 5 and 6 year olds, that's not normal. And the key is at all of it is that around age 3,
everything should be at that mature swallow pattern.
Everything should be at that mature swallow pattern. And if it's not, then we need to start working on it. And there's a reason why.
Absolutely. I mean, how many kids do we get in who come in with that continual munching pattern, lack of that rotary chew? So.
Or the open lips while they're chewing and half the food is coming out as it's going in.
Yes.
So we're super grateful to Mandy Hart for sharing with us her chewing song. She's been using this in her therapy for years and years, and so she was kind enough to let us share it with everybody. And now I use it all the time. I think in this effort to create this rotary chew and teaching children that they have to chew on both sides, like that one asymmetric child, the one I was telling you about that he wasn't using one side properly or even effectively. He only chewed on the left side. So now he only chews on the right side. and he's chewing chewy foods like beef jerky is his favorite food. I know.
But we had Starburst the other day.
And we had Starburst the other day. And Tootsie Rolls if you really want to bring in some sweets. But if you want to stay away from the sweets, there are options. Carrots. There are lots of options. But he's eating predominantly now on his right side. And we're seeing an improvement. And he's aware of it, which is really a step in the process. So the chewing song, should we sing it?
Yeah, let's do it. And we love Mandy's hand movement, so we're going to do that too.
Okay, ready? Chew, chew, chew and over. Chew, chew, chew and over. Chew, chew, chew and over.
Food goes down the slide.
Yeah, so we have a little image of a slide there. And guess what? Our kids actually sing this song now.
Yeah, they do.
They do. But then we felt like we needed to take it a step further because chewing is just one piece.
And for our older kids who might be more cognitively ready to understand
the whole process of oral pharyngeal transition and transport into the pharynx and down into the esophagus, you really want to allow them to be able to move to the next step. So, okay, we haven't sang this one in a while.
All right, Twinkle, Twinkle.
Okay.
You ready?
Take your food and chew, move it over, it's what you do. Chew and chew once more, make a ball and lift the floor. Bite your teeth and close your lips, swallow back and take more sips. So the reason that we really wanted to have all these words, it's quite wordy.
It is wordy.
But it really tells you all the steps to a proper swallow. So chewing bilaterally, chewing on each side evenly, and then making a bolus, forming a bolus.
Very hard.
Very hard.
For some of our
Some
children.
of them, they have the food dispersed all
Everywhere.
over the place. But if you make that bolus and then you lift the tongue up to the ridge, up to the bump,
getting that intraoral suction.
Also biting those teeth.
Biting the teeth.
You have to have the contact of those molars, right? And then closing your lips, then using that intraoral suction to swallow back. And then to continue with more trials. So use it as you want, if not as in a way to educate your patients, but actually to practice it. Yeah, these are so cute.
Awesome. So as you'll see on your lesson sheet as well, we have a section for chewing practice where you can write in different chewing activities. So we want to make it fun, of course. So we've come up with 3 ideas, and
I'm sure the ideas are endless. You guys share what ideas you come up with us on the Facebook page. We want to see them.
We do. So the first one I love is target practice. That's what we're calling it. So it really works on that lateralization of the tongue. So it's really taking something small. Cheerios work really well. I mean, we used Cheez-Its the other day. So you're going to stick, I don't have food to like really show, but you stick it on the tip in the middle. And
you'll see it in the video.
Yeah, you'll see it in the video. And really working to place that food on, I call it the big back teeth. So really lateralizing that tongue to the side, so you can have them practice on one side, you can have them do it on the other side. So really getting that bilateral as well.
Some kids actually, because they've not practiced this, they put the food just on their back molar.
Yes.
And so it's a great time to practice taking and using their tongue in a capacity that maybe they haven't before.
Correct. So we love that one. And then bear bites. So you are going to be using what we call a hard munchable. So we think about large raw carrot sticks, celery sticks, beef jerky. Stale licorice is surprisingly a great tool. Yeah, dried fruit.
Tootsie Rolls,
things like that. So you're really going to have, it's not about biting and chewing, but you're going to have them just practice chewing. So making bite marks.
Right.
Yeah.
I was comparing mine with my little guys the other day, and he was like, your teeth are big. And I'm like, I'm a bigger person than you.
And then you can look at the bite marks that they've made in those surfaces of the food. So working on that musculature. And then
Lollipop lips,
I actually have lollipops.
Oh, you do?
I do.
Great. So prepared.
Do it. Okay, one for you.
Sure, thanks.
Okay, so you're going to take a lollipop. Okay. So you're going to place it on your back molars of one side, and then you're going to have the child, perfect, you're going to use your tongue to lift it up to the other molars.
Tongue lateralization at its best.
I love it.
Tastes great.
And they love using the lollipops.
Not that we advocate for so many sweets, but it's nice to once in a while give them a little treat.
Absolutely.
As they're working on their celery sticks and carrots.
Yes.
To expand their repertoire, they're happy to get a little sweet sometimes.
So, yes, go ahead. Perfect.
So,
okay. Yeah, so food chaining, really based on Kate Toomey's SOS approach, it's a nice way to introduce different foods, novel foods, non-preferred foods to children by linking it to something that they like or something that they're comfortable with.
So they choose one item.
So they can choose. So we usually do it. So for example, I have my handy dandy. We don't know what to call it yet. My teacher assistant at school made this for our students for lunchtime, and I love her. TT, her name's TT, love her.
Oh, you were going to call it the TT tilt board or something.
No, it's a slant talker.
Oh, a slant talker.
And you didn't like it.
We're
going to coin it a different term. But so typically our kids love our Cheez-Its, so we have that first. And then in this particular example, we've chained it by color and by shape in a sense. So we went from an orange cracker to the orange carrot. You could choose the orange veggie stick, or you could do it by shape. So the baby carrot's sort of a rectangle, and the veggie stick is also in that rectangle shape. So there are many examples of categories. So as you see here, you have colors, different foods. You have shapes.
So if you were going to do, let's say, I was going to go back to circle.
Oh, yeah, let me go back.
One. If you were going to choose 3 foods to chain by circles, you might choose to do those, banana slices. I love that.
Yes.
Those are hard munchables.
Yes.
They're not always the easiest to chew, but maybe you would partner that with a rice cake, and that might be a food that they've not had before. And then maybe if you want to introduce some protein and really get them to work, you might introduce a pepperoni or a sausage patty.
Absolutely.
These are
endless ideas. So you can chain it by one category or multiple, which we'll see in a few slides.
And we usually, for the sessions, like I've been bringing in some of the food, but I think it's fair to ask the parents to bring in some items. Talk about what you plan to do in the next session and what they are willing to bring in, and then you go partner it with something that you think you could challenge the child with.
Absolutely. So more shape ideas, and then we have taste. So salty, sweet, fruity, cheesy, chocolatey, my favorite, sour, crunchy. And then texture, tactile. So I think actually crunchy and chewy go in this one for texture, tactile. So sticky, creamy, puree, soft, mushy. But here's really some examples. So I
love this.
I've taken some of the foods and chained it by 2 categories. So for the first one, if you start with goldfish, chain by color to Cheez-Its, chain by shape to saltine. So from square to square. So really be creative with what you do. You can chain it by 1 or by 2, or if you have more than 3 foods, you can do it more. So just some nice examples.
And remember, in that assessment time, you've taken a great list of what their preferred and non-preferred foods are. So you might always want to grab like one non-preferred food item and build
Absolutely.
from there, knowing that they're
Absolutely.
going to bring something they like for the other items, but there's going to be something, and they don't have to swallow it.
No.
We've talked a lot about this.
No, you don't have to swallow it. So I find a lot of kids, they're very aversive, but there are also 32 steps to eating, which is also based on Kate Toomey's SOS approach. When we think about going from tolerating the food in the room to actually accepting and swallowing, there are baby steps, many, many, many baby
Putting it
steps.
to their lips, smelling it.
Right. So
Putting it
getting
into it.
something to the lips versus having something on the table, there's many steps involved in that process. So if they, we often have a trash can nearby, they can always spit it out. So you want to make it a safe space to know I don't have to chew and swallow. I can put it in my mouth, taste it, and then I can get rid of it. That is fine.
I know they might do that 10 times before they actually take to the next step and swallow it.
Absolutely.
Yeah.
So you'll have a lot of fun with this, I hope.
So hopefully you can use your lesson plan then to write down what chewing exercise you did, whether it was the bear bites, et cetera, and then what 3 food items you tried, so that then at home you can do similar for homework. Speaking of homework,
Yes.
we've talked a little bit about this. I think it's really hard in an early intervention program to give homework, though if a parent is invested and willing to continue to do these exercises at home, fantastic.
Yes.
We are going to have a video with Mary from the Myo Munchie company
So
in the
exciting.
coming weeks. Yeah, she's fantastic. She's based in Australia, so we'll probably do it like in the middle of the night. But in talking with her, that is a device and an appliance. It kind of looks like a mouth guard, and it's very chewy, and I find it equates similar to the tube chews, the tube bounce that we use. But it's able to go all the way around all of the dentition with the lips closed while they breathe through their nose. So we were thinking that a great homework might be to fit the child for a proper sized Myo Munchie, and then have them do it for 5 minutes of chewing, lips closed, breathing through their nose, tongue back in proper posture for homework while they're watching a TV show or playing with their toys.
Absolutely.
And we've seen a nice outcome with that. So that's one thing that we've talked about encouraging our patients to do. And once we do that little tutorial with Mary, you might feel more comfortable prescribing that or recommending that for your clients to do for homework. So I think that this pretty much, Julie, takes us to the end. I think we've covered, these are just the dauber pages that they can do for homework. I don't know how far these pages go.
We'll let Julie.
Everything. We just wanted to really end it with encouraging you, first of all, to be excited about Tiny Tongue Tips. Oh, I don't think it is. Or maybe it is, but it went away.
Oh, okay.
We can't see it, but you can see us. Anyway.
Hopefully you're not sweating too much.
I know.
It's really warm.
Like 85 degrees in this room. But I hope that you guys have found this tutorial useful. I hope that it's kind of broken down Tiny Tongue Tips in a little bit of smaller sections for you, and you can kind of wrap your head around how to use it with your clients. I hope you're as excited about it as we are. I mean, we really feel like this is an essential early intervention program for not only kids with myofunctional disorder, but those that are at risk for a myofunctional disorder. Like, what a great way to integrate this into your business.
And it's so fun. The kids love it.
Yes.
They love it.
I think they love it. I think they're going to benefit from it, and I think you guys are going to benefit from it in your business as well. So as you start using it, feel free to reach out to us with questions. Feel free to reach out with us with concerns. Feel free to reach out to us with successes. You know, when you are part of the membership, you can post on the membership page and share your stories, because we can't wait to see the great success stories that we get to see.
And we want to hear your ideas.
Yeah, we want to hear your ideas too.
Yes.
I mean, this was us sitting in a room coming up. I know that, you know, we had talked about getting everybody's ideas, but I thought it would take years to develop. So we want to hear your ideas because we want to share them with everybody. But with that said, that's Tiny Tongue Tips.
Yes. Enjoy,
and thanks so much for spending time watching this very long video. I hope that you get a lot out of it. Okay, take care. Have a good day, guys.